Order. Question number 8, Dr. Jian.
Mr. Speaker, my question is to the Minister of Health and asks, what progress has been made in providing improved child health services?
The Honourable Tony Ryle.
Mr. Speaker, the government's made strong progress in improving health services for children. Immunisation is now at a record level of 93% for 2-year-olds. Free doctors' visits for children under 6, day and night, 7 days a week. A $24 million program to address rheumatic fever, and we've rescued the Before School Checks program, which has seen almost 140,000 children given free health and development checks before they start school. The government's policies are not so much about closing the gaps, but lifting for all, especially those most in need, and this is well demonstrated by the immunisation success story. While the immunisation rate for our children has lifted, the increase in the immunisation rate for Māori has lifted much greater, from 73% to 92%, and children of Pacific Island ethnicity from 80% to an unprecedented 97%. In terms of income, this is very interesting, the poorest income groups have exactly the same immunisation rate as the wealthiest groups, 94%.
Dr. Jian.
Supplementary. What progress has been made with the new program to reduce rheumatic fever, a third-world disease particularly prevalent in Maori and Pacific Island communities?
The Honourable Tony Ryle.
Well, Mr. Speaker, I think the first point I need to make is that rheumatic fever can develop into a life-threatening heart disease and have the patient on 10 years of monthly penicillin injections. But this very serious third-world disease can be prevented, and it is the National Lead Government's key result area to reduce the incidence of rheumatic fever by 2/3 by 2017. What I can announce today is that the largest initiative ever in South Auckland to deal with rheumatic fever will be launched on Friday. One of 8, it's going to be opening at the Romamai School in Otara, which will be the first of 18 school-based clinics in South Auckland. Clinics will open in Manurewa, Mangere and Papakura schools, and clinics will check throats and skin infections and provide antibiotics and provide access to services for healthy housing and injury prevention. A great achievement for New Zealand.
Barbara Stewart.
Thank you, Mr. Speaker. What action is he taking to ensure that all rural areas, including Invercargill and Lumsden, have access to free after-hours urgent health care for children under 6?
The Honourable Tony Ryle.
Mr. Speaker, as the member will know, the scheme is not compulsory, and DHBs are negotiating that with various localities. We're currently at 90%, just over 90% of the country providing that access. That's a tremendous achievement for free after-hours under 6s, and I look to progress in the southern region with those particular communities in the next while.
Question number 9, the Honourable David Parker.
Thank you, Mr. Speaker. My question